This is going to be Critical Care Pharmacology Part 7, Pulmonary Drugs. And in pulmonary drugs, our goals are going to be to relieve bronchial constriction and increase oxygen delivery to the cells. So, Sympathomimetic Aerosols, this is going to be a rescue inhaler. Albuterol, Proventil or Ventolin class, sympathomimetic, beta-adrenergic agonist, bronchial dilator. Actions on this is going to essentially stimulate the beta-2 receptor site, which agonism, that's what that means, stimulate, serves as a beta-2 agonist, exhibits a slight degree of beta-1 or alpha properties as well, achieves bronchial dilation, promotes insulin release, and helps treat hyperkalemia. And our best guess on this is why it helps in hyperkalemia is the increased beta response increases the ATPase sodium potassium pump usage. So it'll kind of drive the potassium back inside the cell and reduce extracellular potassium levels. Indications: bronchospasm, hyperkalemia. Contraindications: tachycardia, cardiac dysrhythmia, or hypertension. If you speed up or get the beta-1 response on this and you have a cardiac dysrhythmia to begin with, it's not going to turn out well. It's going to exponentiate whatever dysrhythmia you might have, especially if it's tachycardic. Side effects: tachycardia, hypertension, cardiac dysrhythmias, anxiety, palpitation, nausea and vomiting, and dilated pupils from an increased sympathetic response. Sympathomimetic aerosols, and these are going to be nebulized medications. Albuterol or Proventil, again, is also a nebulized medication. Adult dose of this is going to be 2.5 milligrams and about 3 to 5 mils of saline nebulized. In the pediatric patient, we're going to give them about 1.25, about half of that, and 3 to 5 mils of saline nebulized. Special considerations: this is going to require adequate amounts of tidal volume, so the patient is going to have to be breathing and getting this medication into the receptor sites, or this is not going to work. You're going to need to be able to get the medication to the distal airways. Class on this: sympathomimetic. It's an anticholinergic, and that's because if we increase sympathetic tone, sympathetic parasympathetic nervous system, we get a sympathetic dominance, and the parasympathetic nervous system decreases a little bit. Now, this helps us in a couple different ways. The trigger to dilate is on the sympathetic side. The trigger to constrict is on the parasympathetic side. So we're going to see lots of anticholinergic meds used with this, or sympathomimetics. Bronchial dilator, last class it's in. Action: blocks acetylcholine receptors on bronchial smooth muscle. Decreases intracellular cyclic guanosine monophosphate, and achieves bronchial dilation. Now, again, how this is going to do it, very simply. This is Ipratropium, Bromide, or Atrovent. If I block the parasympathetic nervous system, I leave a sympathetic dominance. If we use this with a sympathomimetic, then we already have an increased sympathetic tone, and it works even better. Indications on this: bronchial constriction. Contraindications: hypersensitivity, and it's not to be used as a first-line agent for bronchial constriction. We generally should start off with an albuterol dosing, and then if the albuterol doesn't work, we're going to kind of soup up the next albuterol dose. So albuterol being a beta-2, again, sympathetic, parasympathetic, beta-2, and we do get some beta-1 from that as well. So albuterol increases sympathetic tone, and then our Atrovent is a parasympatholytic or anticholinergic, and it's going to decrease parasympathetic tone. Two things we'll get out of this: we'll get more bang for our buck on the sympathetic side, one, and two, by depressing the parasympathetic nervous system, we have also suppressed the trigger that got us the bronchospasm to begin with. Side effects on this: tachycardia, dry mouth, palpitations, nervousness, and headache. Dose: 500 micrograms or 0.5 milligrams. Pediatric, 125 to 250 micrograms nebulized, so a quarter or half of the amount that we would give an adult. Special consideration, we often administer this with albuterol. Levalbuterol Hydrochloride, or Xopenex. Class on this is a sympathomimetic beta-adrenergic agonist bronchodilator. Has a chemical relationship with albuterol, exhibits a higher specificity for beta-2, which means we aren't going to get as much beta-1, or we are not going to get as much tachycardia, but we still can get it. Gives longer duration of action, achieves bronchial dilation, and facilitates mucus draining, increases vital capacity, which means we can move more air across our lungs. Indications: bronchospasm. Contraindication: hypersensitivity to levalbuterol, or if they're less than 6 years of age, and then obviously if you are pregnant. Side effects: nervousness, palpitations, dry mouth, headache, and tachycardia. Dose on this on the adult, 0.63 to 1.25 milligrams via the nebulizer every 6 to 8 hours. And the pediatric patient, 0.31 to 0.63 milligrams via nebulizer every 6 to 8 hours as well. So half to a full, or half to the lower end of the adult dose for the pediatric. Special considerations: please use cautiously in patients with cerebrovascular disease, coronary artery disease, any kind of dysrhythmias, especially tachycardias. It can still give us a little bit of beta-1. Convulsive disorders, hyperthyroidism, diabetes, inadequate tidal volume needed to distribute medication to the distal airways. If they can't move air, we're going to have to get more aggressive. Maybe a loading dose of epinephrine should be considered. An intubation to where we can nebulize this directly on the tissues. Sympathomimetic injection. Terbutaline or breathine. Class on this is a sympathomimetic beta-adrenergic agonist bronchodilator. Stimulates beta-2 adrenergic receptor, and beta-2 is smooth muscle dilation. This is going to result in bronchial dilation, which there's smooth muscle there. Relaxed peripheral vasculature, which there's smooth muscle there, and relaxed uterine muscle in case of contractions. And again, there's smooth muscle there. Indication: bronchospasm or preterm labor. Contraindications: known hypersensitivity, severe hypertension, coronary artery disease, lactation, concurrent digitalis toxicity. If they're digitoxic in any way, we are not going to want to administer this. It's going to get things out of control. Side effects: tachycardia, hypertension, nervousness, palpitations, nausea, vomiting. Dose on this is going to be 0.25 milligrams sub-Q and repeat every 15 minutes. The maximum dose on this is going to be 0.5 milligrams in 4 hours. So we can actually repeat this once. Pediatric, 0.005 to 0.01 milligrams per kilogram sub-Q. Repeat if needed every 15 to 20 minutes, and the maximum dose on this is going to be 0.4 milligrams. Special considerations: monitor their vital signs and cardiac monitor. Hydrocortisone Sodium, or Solucortef. Class on this is going to be skin and mucous membrane agent, anti-inflammatory, hormone and synthetic substitute, glucocorticosteroid, or glucocorticoid, and a mineral corticoid. Action: serve as a short-acting synthetic steroid, acts as an immunosuppressant, achieves anti-inflammatory effects. Indications: chronic restrictive airway disease, COPD, asthma. Contraindications: idiopathic thrombocytopenic purpura. I don't know why my platelets are low. That's what that word essentially means. Psychosis, Cushing syndrome, acute hepatic dysfunction, or ages less than 2 years of age. Side effects: hypertension, hyperglycemia, flushing, tachycardia, anaphylactoid reactions, weight gain, mental disturbance, thrombocytopenia, muscle wasting. Dose on this for the adult is going to be 1 milligram IV every 6 hours. And the pediatric, 1 to 2 milligrams per kilogram IV. Special considerations: use cautiously in patients with diabetes, hepatitis, convulsive disorders, hypothyroidism, gastritis, congestive heart failure, hypertension, and renal insufficiency. That ends part 7. You got any questions? Feel free to email me, roy.smith@redlandscc.edu or smith@imsa.net. Thank you.